go. Well, good morning, Queensland. I can report today we have 20 new cases. 4 are overseas acquired and 16 are in the community. That puts us at 82 active cases now in Queensland. We've had 14,666 tests in the last 24 hours and 19,479 vaccinations at our Queensland health facilities, which puts us at 89.03% first doses and 83.07% second dose. So we are 1% away from hitting 90% first dose, which is fantastic. So please keep coming out and getting that first vaccination and starting your journey. But also, if you are due for your booster, we know how important boosters are. You can go to any community pharmacy, GPs, or of course the Commonwealth State vaccination centres to get either the Pfizer or Moderna booster. We can report we now have a total of 5 Omicron cases reported in Queensland, and good to see people are still flooding into Queensland. We've had 105,923 GV border passes, so those are people coming from Victoria or New South Wales, ACT and also Greater Adelaide. Everyone has probably seen the figures coming out of New South Wales and Victoria. Quite concerning that we've seen 2,213 new cases overnight in New South Wales and another 1,510 in Victoria. So knowing that those cases are growing so rapidly interstate and we have so many people coming from those states into Queensland makes it more important than ever that we come out and get vaccinated, that you come and get tested if you have any symptoms whatsoever and isolate until you get that result. And of course, checking in. And it's wonderful to be here in Minister Grace's local community at New Farm at Joedy's Cafe, because the new rules started at 5 a.m. this morning, that going to cafes and pubs and clubs and hotels, museums, libraries run by state governments, stadiums and other facilities, you now have to be fully vaccinated to access these sites. So not only checking in, but also showing your vaccination. And of course, you can have the comfort and confidence that when you come to these sites, all of the staff are fully vaccinated as well. So if you're still unsure about what businesses are fully vaccinated and which ones don't require vaccination, many of them have the signs up saying whether they're a vaccinated or unvaccinated site, or you can look at the Queensland COVID website and have a look at what rules apply to what businesses. Now, I've heard some media reports this morning saying where businesses can choose to do this. Can I make it clear? This is mandatory. If you are in the category that must have staff and patrons fully vaccinated, you don't have the choice to opt out as a business. You are bound by this. We know that the majority of businesses out there are going to do the right thing. We know patrons are going to do the right thing. We have absolute confidence that this is going to help us slow the spread of COVID in Queensland. And with almost 90% of our eligible population already at first dose, we know a large proportion of the community are already fully vaccinated and are ready to go and go out and enjoy their recreational time and, of course, enjoying the Christmas period. Now, these new cases, again, are reported in Brisbane North, Brisbane South, West Moreton, Sunshine Coast, Gold Coast, and we have new cases in Cairns today. What this shows is this virus is spreading across Queensland, with thousands and thousands of people moving around this state over Christmas to visit loved ones and to holiday. We know this virus could pop up anywhere, anytime in Queensland over coming days and weeks and months. That is why from today we are announcing that mandatory mask wearing will be in certain settings across Queensland. Now, I know there'll be some towns who say, well, we've got no cases, but what this is about reducing the risk of those cases coming to your regional or remote towns while thousands of people are getting in their cars and in planes and on trains and travelling around Queensland. So from 1 a.m. tomorrow morning, there will be new mask rules that require in indoor retail, so shopping centres, supermarkets, retail outlets and shops, you will be required to wear your mask while you're in those settings. Also, vulnerable settings. Again, if you're going into a hospital, either as a patient or as a visitor, you're going to aged care or disability facilities, into prisons or youth detention centres, you must wear a mask. Now, of course, it still remains mandatory to wear masks on airport precincts and on planes, and that will continue. And also, it will be mandatory on public transport. And this includes ride share, taxis, Uber, all of those things. So please, if you're on any public transport, ferries, buses, trains, cars, you will be required to wear a mask. Now, you are not required to carry a mask with you at all times, but we strongly encourage it because you never know when you need to pop down to the shops. So maybe it's good to have one in the handbag or in the glove box, have it available to you in case you do need to go into one of these settings where a mask is required. We don't require it in other settings outside of the ones I've announced, and that includes cafes, restaurants, pubs and clubs. Why? Because as of today, all of those venues require fully vaccinated people to be on site. The venues we've just talked about, retail, shops, public transport, both vaccinated and unvaccinated people are allowed to go to those settings to access that transport and are all mixing together, so the risk is greater. We know masks are easy to wear and they make a difference. Look at how many times we have reduced and stopped the spread of this virus this year by bringing in masks. So I know it will be new for many, many people in Queensland, particularly outside of southeast Queensland. But it is such a small ask for such a huge benefit. So please, follow the rules, put your mask on, and as the Premier said this morning, we will review the mask wearing rules when we hit 90%. So in the meantime, we want everyone to stay safe. We want everyone coming together at Christmas, spending time with loved ones, and we want to keep you as safe as possible and slow the spread of this virus to also slow the pressure that will inevitably come on our health system. I'll now ask the Chief Health Officer to say a few words and then Minister Farmer. And of course we have the Police Commissioner here today as well. Thank you.
Thank you very much, Minister. As expected, we are now seeing COVID cases from as far north as Cairns right down to the Gold Coast. And this is quite expected, and this will, of course, continue. The majority of the cases at this stage are Delta cases. We've had 5 confirmed Omicron cases, but we know that those numbers will increase. We know that is inevitable, that Omicron will inevitably become dominant, and we will not be able to stop it. That is expected. The mask direction that I issued today was intended specifically to slow down the spread of the Omicron strain, giving people an opportunity, those that are eligible, to get that 3rd dose of the vaccine specifically. The group of people that are now eligible to receive the 3rd dose of vaccine includes some of the most vulnerable. It will also give our opportunity for will reduce the strain on the hospitals through the reduction in the transmission of the virus. One of the most critical things that I think we need to state over and over again about mask wearing is not just about protecting yourself, it is also about protecting others. It works both ways. So it is a socially desirable thing to be wearing a mask, and I think it's somewhat antisocial to be wearing a mask in crowded environments. The mandates as the direction as it is written, I think is relatively expected. I think most people expected a mask mandate to appear around about now. I think that what we are requiring is not particularly onerous, and we're putting a lot of emphasis on personal responsibility. So even if it's not necessarily mandated in the area designated in the direction, we still ask you to think about wearing those masks. Just to go over those numbers again, we've had 5 cases in Brisbane North, 8 in Brisbane South, 1 in the West Moreton area, 2 in Sunshine Coast, 2 in Cairns. Cairns is the first cases we've seen for a while, and 2 in the Gold Coast. In terms of the source of these infections, 7 of these were known to be from interstate, 4 from overseas, 3 were from contacts within Queensland, 4 were not linked to other cases, so we have not found a link in 4 cases, and 2 are still under investigation. And as we've said over and over again, these numbers will continue to increase, and that is expected. We've had 2 additional Omicron cases just in the last 24 hours, 1 in Brisbane, 1 on the Gold Coast. Both of them are directly linked to this very large cluster in Newcastle. I can say, and again I've spoken with the doctors involved in these cases, both of these individuals were vaccinated and neither of them had symptoms. They were simply screened because they were contacts. Just to update you on the residential aged care facility in Holland Park, you'll recall that there was a visitor who subsequently tested positive for COVID-19. I can say in the first screening of all the residents there, all the tests in the initial screen have come back negative. The individual involved mostly visited a couple of close relatives. It is still a little early before we can say confidently that there is no transmission, because it's only the first 24 hours. But I can say that 83% of the residents had received at least 2 doses of the vaccine, 4% had received 1 dose of the vaccine, 13% were not vaccinated in that facility, and I am told that the rollout of the third dose of the vaccine at that facility had begun last week. There are a total of 139 residents in that facility. Thank you.
Good morning, everyone. So from today, or just some hours ago, everyone entering pubs, clubs, restaurants and cinemas will need to be fully vaccinated. Businesses today, and you've seen it here already, must display the new rules, and this will really help inform the customers. It is actually up to the operators to make sure that the patrons meet those requirements. We urge Queenslanders to be extraordinarily respectful and be kind to each other. This is the law. If businesses are experiencing difficulties or concerns, please do not hesitate in calling the police. We have increased our activity in this space. There are increased patrols, as well as already the compliance checks that we are conducting on businesses. And remember, we've always taken a really educative approach on this, but if there is blatant disregard for the rules, for the law, there are fines for individuals up to $1,378 and for businesses from $6,892. Currently, as of just half an hour ago, there are 8 business-related jobs in relation to the new rules. I will keep everyone updated, obviously, throughout the week on that, but currently there are 8. I just wanted to give you some other figures, and the Minister's already touched on this. Since the borders opened on Monday, there is 105,900 GV passes. Incredible numbers. On the borders, we've intercepted 31,598 vehicles. Of those, in the last 5 days, we've turned around 126, intercepted 1,485 heavy vehicles, and turned around 19 of those. In the last 24 hours, 86 flights have come in from hotspots, and on those we've checked 3,966 passengers. 21 people have been refused entry. 86 have been put into quarantine from hotspots, and 1 from the road borders into quarantine as well. What we're finding with respect to those 86 in the last 24 hours, people are still waiting for their PCR tests from interstate. So rather than turning those people around, we've just put them into quarantine until those tests come through. Thank you. Thanks.
Well, today is a really big day for hospitality and entertainment businesses. Today is the day that those businesses say goodbye to COVID restrictions and hello to a new normal. We've got Queenslanders safe, we've got borders open, and in other states, they are fighting to regain their freedoms. We are fighting to hold on to ours. It has been 638 days since restrictions were first placed on Queensland businesses. It was on the 19th of March 2020 that we asked businesses to limit their numbers to keep Queenslanders safe. And since that time, we've isolated, we've quarantined, we've had some lockdowns, we've got tested, but most importantly, the vast majority of Queenslanders have got vaccinated. I want to thank particularly the businesses who have really borne the brunt of the COVID restrictions 638 days ago. I've been around to my local cafes this morning in my electorate of Bulimba in Oxford Street, and absolutely the businesses are doing a great job, and I want to thank them for that. They are absolutely committed to keeping their staff and their patrons safe. And I also want to thank the patrons to a person. The business owners have expressed their gratitude to the patrons who've come in and gone out of their way to make it easy for those businesses to implement the new normal. And we have some very good figures about the way Queenslanders are making sure that they're equipped with the green tick. We know that there are now 2.1 million vaccination certificates linked to the COVID app. There were 4.79 million individual check-ins yesterday. This is up 40% since Sunday. So that is a great effort from Queenslanders, absolutely doing the right thing. We know that unfortunately there are people who are already giving businesses some stick. And I want to say to those people, please think about what sort of person you want to be. There are really strong penalties for refusing to show your vaccination certificate, but we do not want businesses to act as police. Businesses will have clear signage indicating that they are only allowed vaccinated persons on their premises. We ask people, if you see that sign, do not go into that business. The business has every right to ask you to leave, and if you refuse to leave, the business has a right to call the police, and we've already heard the Commissioner say that the police are absolutely at the ready. But we're saying to people, just don't go there in the first place. If you know you need to be vaccinated, just don't go into that business. If you do, please be kind to the staff. And I want to just encourage businesses. I know this is a new normal, and I know there are a number of businesses worried about abuse, worried about making sure they're doing the right thing. We have a package of materials that's there to support businesses. We have a short online course which takes businesses through a range of challenges they might have, including how to manage aggressive customers, and we've had nearly 3,500 businesses access that course just in the last week. We also are hearing that there are still a number of people coming into businesses who are not sure how to download the green tick and how to manage their app. Please go to the COVID-19 website, and there are step-by-step instructions on how to do that. So the biggest message is thank you to Queenslanders for doing the right thing. Thank you for supporting your local businesses, and thank you to those businesses for what they've done in the last 18 months. And I'll just hand over to Joedy now of Joedy's Cafe in Minister Grace's electorate, who's done a pretty good job already this morning. Joedy.
Thank you, Minister. I just want to say a big thank you to everybody who has come out to show support to all small businesses today. It is a milestone for myself and my business. On the 18th of March 2020, we opened our doors to the public, and the day after our first restrictions and our first capacity limits hit. So today is a milestone for us. We're quite excited to operate at full capacity, even with some level of mandatory things in place. It is very, very reassuring to us that we are moving in the right direction. We're very happy to see how the community around us has been supportive and following the mandate and abiding by the current rules, and it is very, very positive for us, and we're very happy to move forward at 100% capacity and to keep on growing, to keep on getting money into our economy, to keep our staff employed, to keep on moving forward and to keep on giving you coffee and great food. So I just want to say thank you to everybody who showed up today, everybody who is out in the community showing us support and all other businesses support. It's a great day for all of us and we're very excited for what's ahead. So thank you very much.
Thanks, Joedy. I have some of the best cafes and restaurants and coffee shops in Queensland, here in the electorate of McConnell, and Joedy's is one of those. Here in Sydney Street, in New Farm, doing the right thing, and I think it's very important that we support these businesses. And of course, there's just three messages. Please get vaccinated. It is about keeping everybody safe here in Queensland. We see that COVID is definitely coming into this state. The numbers will undoubtedly increase and we want to keep you safe. The second is from 1 a.m, wear your masks. That keeps you safe, as we have found, and Queenslanders have done a wonderful job in the past, and I'm sure that they'll do that into the future. And thirdly, can I also say thank you to all the businesses in McConnell that are doing the right thing, and be kind. Be kind to those businesses that know the law and want to make sure that everyone in their premises is safe. But today I had a coffee at Joedy's and I was speaking to one of my constituents, Ian, and he got COVID 2 years ago. And he was saying that it was the sickest he has ever been in his life. And even today, there are still shadow on his lungs from when he had COVID 2 years ago. This is not something that we want to get. Protect yourself, protect your family, protect your community, and make sure you get vaccinated, wear your mask, and more importantly, be kind to staff. Thank you.
So we've adopted that posture purposely because we think it's unreasonable to send someone back home if they're only waiting for a test result. A lot of them, it's only 24 hours, but certainly it has been a wait for some of those areas, so we're trying to do the right thing by everyone that comes into the state.
Will there be a limit on that? What's the capacity in the hotel quarantine system at the moment? We have to cut that.
So there is a lot of capacity in the hotels at the moment, obviously because Queensland has opened up, but certainly if there's issues with the testing, we'll make sure that someone goes into hotel quarantine so they can get their tests.
Were they businesses that you had sort of targeted, businesses that have outed themselves that might be compliant, or these complaints that you got?
No, so these are jobs that have just come in on the system, so we're keeping a tally on all of the jobs at a local level but also a central level, so this is across the state. But look, those people that have already given us good intelligence that they're going to do the wrong thing will be getting a visit by police.
So the ones this morning, were they over and above that? These are
So that's over and above that, yes.
So will you commit to visiting all those businesses that I guess had outed themselves?
The ones, I think it's disappointing that people have done that, but they have given police very good intelligence, so they will definitely be getting a visit from police.
The businesses that you have had complaints about so far, are they in any particular area?
So I don't have the details of exactly where they are. As you can appreciate, it's 5 hours since we've started this, but certainly some of that information will come through the day.
And those people do have to go to hotel quarantine while they're
I can't answer that question, Joel, sorry. There is obviously, they know they're coming into the state without a PCR test. So here we are just trying to be, very compassionate in the way that we're going about business. So we're putting them in hotel quarantine. But that usual payment system would apply to everybody because they've got on the plane without the test and we're doing the right thing. We are expecting the numbers to increase. We've seen this in other states. So in the first couple of days, until everyone gets used to the new directive, there will be a spike. But we also see in other states that it actually levels out over a couple of days as well. So As been alluded to many, many times, I ask that people do the right thing, respect the staff. This is the law. This is the law. Respect the staff. And please, if staff can't deal with the situation, to give us a call. As I've indicated, we have done thousands of compliance checks on businesses already. That will continue, but there will be heightened activity around this new directive.
Are there reports that people are not wanting to go out any places, particularly over next week, because they're scared of being deemed a close contact? Are you concerned about that?
Well, that's why what we're doing today is so important, because I don't want especially elderly people feeling isolated in the home, which is what we saw in 2020. By mandating businesses like our clubs and our pubs and our hotels, it means that they can have the confidence to go catch up with a friend for coffee or lunch, go down to the Leagues Club or the OSL, play bingo, do line dancing, catch up with friends, knowing that that entire site is fully vaccinated, that all the staff and every other person there is vaccinated. So we want to give confidence to people that to come out and do these recreational activities, that they're at much safer venues than otherwise would be.
Why can't we go to 7 days now, though? Why, instead of waiting until January 1?
Because we need time. We can't lift everything at once. That would not be sensible or responsible. New South Wales and Victoria did not lift all their restrictions at once. They've eased out of it. The reality is we needed to see how many cases were coming in. Omicron has come on the scene. That's very new in the last couple of weeks. So we just need to be able to monitor, to manage this in a sensible way before we get to the point that we're only requiring people to quarantine for 7 days. Because if we do that and people end up turning up positive on day 12, day 13, that's smack bang in the middle of Christmas and New Year, right before the big gatherings on New Year's Eve, it just wouldn't be responsible.
The mask mandate, is there a likelihood that it may exact the order to encompass hospitality, reducing cases?
Look, we just have to wait and see. Again, it's not just about cases. And, the reason why we've been talking about how many have acquired it interstate versus locally is because we still have very little community transmission. So these people are coming in, because they're all fully vaxxed, most of them are asymptomatic. And so, we're hoping we don't see large spread because they're fully vaccinated. The people most at risk of catching it from these fully vaccinated asymptomatic people are people who are unvaccinated. And they're the ones who are going to need our health services. I think, the measures we've announced today are the right measures for the moment. Let's see how it all pans out. But we're mindful that, we've asked a lot of our pubs and clubs and hotels. They're fully vaccinated sites. And let's just see what sort of transmission we see over the next couple of weeks. And also, just because we've mandated masks in retails and shops doesn't mean people can't wear masks to walk in and out of these sorts of venues and just take it off when they're sitting down. That's a personal choice, but one that people might want to take to feel a bit safer.
Finalised how hospital and home is going to work now that cases are beginning to ramp up?
Yeah, so definitely, our team have just done such incredible work around the planning of all this. I get regular briefings. I got a briefing again yesterday afternoon about our planned rollout for how we manage people, who goes into a hospital, what's the risk factors in managing that, and who can be managed in the home. And we're even working through what do we do with people who don't have a home. So our homeless, people who are in DV situations, people who are on holidays, who find themselves a close contact and have to quarantine, but can't stay in the hotel that they're in. They've run out of money, they can't stay there for another 2 weeks. So we're working through all of those initiatives, and we're very confident that we've got the right measures in place to manage these people. You'll see more on that very, very shortly. But yeah, look, I wouldn't say they're chewing up resources. We've managed these cases in our hospitals for the entire year, since last year. This has been our strategy, but we need to move to the next one. We're going to move to this next strategy probably in the next week or so. but we just need to have everything ready to go so that every single person who is going to be managed in the home, that we have all of the checks and balances to make sure we can check on those people and we can give them all the support that they want and the reassurance they need that it's okay and it's safe to be at home instead of a hospital. And that'll make sure we've got the bed capacity that we're going to need for those really sick people.
Have you considered or would any consideration be given to locking out Sydney and other, I guess, areas around Australia which are high numbers?
No, that's not under consideration, no.
And Dr. Gerrard, how are these cases being picked up? Is it people from interstate who have been identified as close contacts? Because we haven't quite hit that 5-day.
For the most part, it's close contacts. Some are symptomatic, but mostly it's close contacts of others. So, yes, so they're not. So if they were positive before they crossed the border, of course they would not have crossed the border. So it's mostly close contacts. Yes. Any of the vaccines recommended by ATAGI are appropriate. Any of those recommended by ATAGI. They're all of those recommended by ATAGI.
With the 5-day PCR test, is there any more detail about how you're going to police that and ensure that people are actually getting this test?
To a large extent, we're relying on people's goodwill. The people of Queensland want to do the right thing, and we're finding they've been doing that from the beginning. So, to a large extent, we are relying on people to do the right thing. We know that some people who cross the border whose tests were negative prior to coming across will have positive tests a few days later. So that 5-day test is very important. But to a large extent, we are relying on the goodwill of Queenslanders. And we know they've done the right thing right up until now.
Is there an automated system to get a text message or some sort of reminder on the day 5 to get your test?
No, there's not a system like that, no.
Are you concerned people will stop checking over the next couple of weeks because they're scared that they're going to close contact?
No, just the opposite. I think people are aware that this virus is coming into Queensland. I think people want to do the right thing here in Queensland.
We are about to hit 5 days since the border opened. Would you expect quite a large increase in cases detected over the weekend?
I think, yes, we are expecting increasing cases every day. It's interesting, we stabilised over the last 24 hours. We haven't picked up many transmissions from individual to individual, and I think that's because our vaccination rates are so high. So we haven't seen much person-to-person community transmission, but yes, we're expecting numbers to increase.
Thanks, guys.
Thank you.
Thanks, Joedy.
Thank you.
So I got my booster shot, everybody, yesterday, Moderna.
You don't have shares, do you, I hope?
AstraZeneca and Moderna.
I thought I'd mention the in-story.
Yes, good. Good story. Yeah, worthwhile.
That would be good to mention, yes. And great to have Joedy here. That was great.
I was listening to you speak, and I thought, wow, that's such a skill. I could immediately